Shame on you, Pfizer. What an absolute disgrace. And we gave these people indemnity. I think it is way overdue, and I think that it's a real shame that this wasn't introduced earlier, because too many people have suffered, and what's worse is that the people who have been injured by the vaccine have effectively been gaslighted and haven't got proper compensation to help with their injuries. And to think that we could spend hundreds of billions of dollars on shutting down a country in regards to coronavirus when young people of healthy working-age people had very little risk from the virus, and yet spend nothing on the same people when they are injured by the vaccine, is gross hypocrisy. I mean, we are here to protect the people. We are not here to protect the big end of town. We are not here to protect corporations, the bureaucrats, or big wealth funds who own these big corporations today. I mean, the corporations are just puppets on the string now. The puppeteers and the puppet masters are actually the superannuation funds here in Australia, or BlackRock and Vanguard overseas. And they have these cross-interests that allow them to get away with lots of things. People have to be fully informed about the risks of the drug before they are taking it. And of course they weren't fully informed at all. Okay, they were lied to. They were lied to by the government, and they were lied to by Big Pharma. And I'm just going to read out some of the missing information that was involved with the sale of this drug. Missing information: use in pregnancy and whilst breastfeeding, use in immunocompromised patients. Now, I wonder why they did that, and I'll tell you why this really matters. Because last week I finally got the TGA to admit that myocarditis is an autoimmune disease. Okay, so they knew. So this is the thing: a normal vaccine, generates an immune response against the foreign body that's in the vaccine. This vaccine doesn't do that. This vaccine creates an autoimmune response, okay, via generating a T-cell response against the little peptides that are presented on the cell membrane. That's in the Pfizer FOI 2389-6 report, okay, that generates a T-cell response. Okay, so that means you're now getting an autoimmune response against your own cells. So the pathway of this vaccine was completely different. It created an autoimmune response. And yet right here, they never actually tested the drug on immunocompromised patients. They've also avoided use. So one of the missing information is also use in frail patients with comorbidities. Well, for example, chronic obstructive pulmonary disease, diabetes. Well, diabetes has jumped a lot in excess deaths. It's one of the largest contributors to excess deaths, and yet they never tested for diabetes. Chronic neurological disease and cardiovascular disorders. Is myocarditis a cardiovascular disorder? And all of this was missing information. And yet again, it's relevant because last week Pfizer and Moderna could not explain why their vaccine causes myocarditis. Well, it turns out that they never actually tried to find out before they rolled this thing out. And of course we've got use in patients with autoimmune or inflammatory disorders. Wow. Interaction with other vaccines and long-term safety data. So they lied, people. They lied and people died. Shame on you, Pfizer. What an absolute disgrace. And we gave these people indemnity.